Defense ministries are monitoring a rise in radiological threats, ranging from the potential deployment of dirty bombs to sudden leaks from decaying industrial waste. A dirty bomb is a conventional explosive used specifically to scatter radioactive material over a wide area. This tension has triggered a quiet stockpiling operation. Governments across the United States, Europe, and the Middle East has begun securing millions of doses of specific medical countermeasures. The historical precedent for this urgency is well documented. When Reactor 4 at Chernobyl exploded in 1986, it sent a plume of radioactive material across Europe, exposing millions to fallout. The 2011 meltdown at Fukushima Daiichi proved these events are a contemporary risk. Industrial infrastructure remains vulnerable to natural disasters and system failures, regardless of the era. To prepare for the next event, world powers are securing large quantities of one highly specific, obscure capsule. The substance inside that capsule is Prussian blue. Originally discovered in the early 18th century, it is a deep blue pigment that was traditionally used to color fabrics and canvases. Medical science now uses that same pigment for a different purpose. It is classified as an essential emergency drug for treating radiation exposure. The World Health Organization mandates that countries maintain supplies of Prussian blue, listing it as an essential medicine for radiological and nuclear emergencies. The US FDA also categorizes the capsule as a life-saving medical countermeasure. This common artist dye possesses the exact chemical properties needed to save human lives from a nuclear catastrophe. The deadliest threat of a radiological event occurs afterward, when individuals breathe in or swallow microscopic radioactive dust suspended in the air and water. This causes internal radiation poisoning. Instead of hitting the skin from the outside, the radioactive material resides inside the body, damaging tissue from within. Isotopes like Cesium-137 and Thallium enter the mouth and accumulate in the digestive tract. Cesium-137 comes from nuclear fission, while thallium is found in industrial medical devices. Left unchecked, they absorb through the intestinal walls into the bloodstream, damaging internal organs. Survival requires intercepting these isotopes in the gut before they can breach the bloodstream. This is why medical responders administer the Prussian blue capsule immediately following exposure. As the capsule dissolves in the intestines, the pigment acts as a chemical sponge. The drug physically binds to the radioactive cesium and thallium atoms. This binding creates a molecular cluster that is too large to pass through the intestinal wall, preventing the radiation from entering the blood. The body's natural digestive process then flushes the trapped, neutralized toxins out through the stool. This mechanical trapping process accelerates the removal of radiation from the body, significantly reducing the internal dose a patient receives. When every nation requires these specialized pills at once, the primary challenge is manufacturing capacity. India has emerged as a primary manufacturer and exporter of this drug, filling a gap in the global supply chain. The technology for this operation comes from the DRDO, India's Defense Research and Development Organization, which manages the country's military technology. Within the DRDO, a laboratory called INMAS engineered the chemical synthesis required to produce pharmaceutical-grade Prussian blue at an industrial scale. India transitioned this technology into a large-scale operation, using its pharmaceutical sector to produce the capsules for civilian populations worldwide. This production power was utilized during a recent industrial accident in Indonesia, involving a leak of radioactive Cesium-137. India acted as a first responder, deploying a shipment of Prussian blue capsules to Jakarta to neutralize the contamination threat. Indian pharmaceutical companies now export the drug globally while adhering to WHO GMP safety standards. WHO GMP refers to the good manufacturing practices set by the World Health Organization to ensure medical products are produced consistently and to high-quality standards. Prussian blue began as a vivid dye for aristocratic uniforms. It is now a biological defense against internal radiation. India's capacity to mass-produce this antidote has established the nation as a primary supplier for nuclear defense logistics, altering the global landscape of emergency preparedness.